Hi, this is Gabriel. Let's see what our friends are doing today. Follow me.
Oh, hey guys, I'm Kaday.
How's it going? I'm Ray.
I'm Steph.
And I am Albert. Let me tell y'all something today. Y'all gonna learn today about the knee. As you can see, we have a picture of a gross anatomy of the knee here. And I'm gonna first talk about what these different parts mean. Okay? So let me ask y'all this. What is the largest joint in the body? Any guesses here? You probably know. It's the knee. It's the knee. So, and it's also one of the most easily injured joint in the body. I'm sure y'all have experienced that. You know, if you're playing sports, exercise, anything like that, you probably have experienced that. Now, the knee is comprised of many, many different components. And I'm going to start talking about that right now. Yes, so we're going to zoom into my knee. You can't really see my knee because my damn jeans are covering. But if I lift them up,
Wow.
you can get just a rough, sketch of my knee. Damn, the screen is down. So yes, I'm going to start talking about the parts now. The four main components that make up the knee: bones, cartilage, ligaments, and tendons. So tendons, what do? They connect the bones to the leg muscles that help you move, your joints. The ligaments join the bones to provide stability to your knee. That's how you're able to stand up and you're not tipping over and all that. Let's go back to the knee, shall we? Common ligaments you've probably heard of in the knee. You know, the ACL, the PCL, the MCL, LCL. These are all very common ligaments in the knee, and they prevent the biggest bone in your body, which is the femur, from sliding. And that also brings stability. So this is right here. You see the LCL is right here, the MCL is right here, the PCL is right here. But the most common one you always hear about is the ACL, which is right here. The anterior cruciate ligament, which is in the front. Okay? So those are the ligaments. And then also the bones, the three bones that form to make the knee joint, which is the femur, the biggest bone in your body. We also have the patella, which is your kneecap, and you have the tibia right here, bam, which is your shin bone. Okay, so those are the bones. The knee also contains what we call meniscus, right here, lateral meniscus. These things act as shock absorbers to absorb shock. So when you're jumping, you're planting, the meniscus will help you absorb that shock. And so those are the different components. Knee is also a synovial joint, which contains a fluid called synovial fluid. I'm sure you all heard about it. We all learned about this in CERT, right? It allows lubrication. It nourishes the joint, allowing it to move smoothly and painlessly. And that's why we do this in the leg extension. The leg extension. Why do we do the partial reps? To warm up the knees, right? We got to lubricate the joints, right? And that's why we have to talk about the synovial fluid. Okay. Also, now that leads us to ask, how does the knee move? You can flex it. You can extend it. So this is extension, this is flexion, and you can rotate it too. I'm going to talk about the muscles that surround the knee, okay? Because that's very important. Because that's why we train clients. Clients that have prior knee injuries. You want them to strengthen those muscles around the joint. It's very important. So first and foremost, the quadriceps. Okay. Front part of your leg, pretty much your thigh muscles. Okay, yes, good feel there. So we have three parts of the quadriceps: the vastus lateralis, the vastus medialis. So the lateral parts. This is the lateral part. This is the mid part, and then we have the rectus femoris. It's towards the top. So those are the quadriceps. Very important to work these muscles because it helps with walking and getting up and down stairs. So it's very important that we help our clients strengthen these muscles if they have knee problems. And that's by strengthening these knee muscles. When they get up and down stairs, it wouldn't hurt their knees. We're going to talk about the hamstrings next, which are the muscles behind your leg. Okay, so right there. Boom. Yeah, good feel. And we zoom in here, Gabe, right here. We look at the back of the leg. So the hamstrings are They consist of 3 different muscles: the semimembranosus right there, the semitendinosus, which points to right there, just the lower part of the hamstring, and the biceps femoris, even lower than that. So these 3 parts comprise the hamstring muscles. Next is my favorite muscle in the body, the glutes. Yes, the glutes right here. Boom, that is your butt muscles. Yes. Butt muscles, these are very important, controlling your knee position and how forces transfer through your joint. So it's very important to strengthen those muscles as well. So if we look here, zoom in here, the glutes, yes, nice glutes here. Gluteus maximus, that's probably one of the biggest muscles in your body, that's the main butt muscle. Also, the glutes also contain the gluteus minimus and the medius. Medius is right here. Oh yeah, right there. Gluteus minimus and medius. They're along the side, the lateral side of your glutes. So those are the 3 main glute muscles. Last but not least, we cannot forget the calves. So the calves, we zoom down here, calf muscles. We have 2 muscles that that make up the calves. The gastrocnemius right here, the top part of the calf, and the soleus, the lower part of the calf. So these 4 different types of muscles are very important, to strengthen, to make sure that, you don't have any knee problems. And that's why we have our clients do a majority of these exercises. But why do we have to talk about the knee so extensively? It's just important to have these muscles strong around your knees. That way, in the long run, you won't run into problems like if you were to injure yourself. Here, at the Perfect Workout, we deal with a lot of clients that have knee problems, knee pain, whether they had knee surgery in the past. They're coming in with, osteoarthritis, osteopenia, or, people who are kind of at risk of getting some of these problems. It's important to strengthen these muscles that surround the knee. I'm gonna now segue to my wonderful colleague Ray, who's gonna talk about different types of knee injuries. Wow. Hello, Ray.
Hey, how's it going, people? Thanks, Albert, for the elaborate description of the knee. Yes, it's very important because we deal with the knee joint throughout our daily life, But the thing is, with the knee and all that, and the joints, it's pretty much, it's not age specific. It's not just the older folks or the young athletic types. It's anybody. Okay, so if you're dealing with the knee, we're talking about mainly like sprains. There's actually 3 degrees of sprains. The first one is actually a strength of the ligament. I'll describe that in a little bit. The second grade is usually is like a overstrain and a minor tear of the ligament. And lastly is a grade 3, which is a complete tear of the ligament. Okay? So as you see it here, Albert described it for you. I like to dive deeper into the ligaments because that's pretty much what holds the knees together. Okay? As you can see here, the ACL, the anterior cruciate ligament. I get confused, so ACL. A lot of times that deals with a lot of hyperextension injuries. Again, that ACL is pretty much helps your knee stay in place in terms of having the knee not move forward. And then backwards, posterior, you have the PCL. Obviously, it helps the knee stay in place in terms of can't move the leg, the tibia, backwards. Okay? And then sometimes you have pretty much the medial inside MCL and also the lateral MCL. Okay, when those tear or strain, a lot of times it's buckling in or coming out. And with those, actually there's instant swelling as opposed to the meniscus, which is a cartilage. Cartilage, again, is pretty much the shock absorbers, as Albert told you. A lot of high impact. It tends to kind of deteriorate as the person gets older. But as you see here, it kind of cushions the bones. And once that's gone or torn, it can be chronic pain. Oh, actually, that deals with a lot of twisting of the tibia. Okay, Albert demonstrated that earlier. Also, the patellar tendon. A lot of times our clients tend to run a lot, which we don't try to advocate as much, or jumping around like myself, playing a lot of basketball, but a lot of pain right underneath the patella. There's a patellar tendon right there, and there's a lot of direct pain I just wanted to touch base on the common injuries and sprains of the knee. There's a lot more to it. Don't want to dive too much into that. But that's pretty much some of the knee information in terms of injuries. I'd like to direct myself to Stephanie, my lovely client.
Alright, so knee pain is often caused or made worse by weakness or tightness in the muscles and tendons that connect to the knees, specifically the hips, the glutes, the hamstrings, the calves, and the quads. Since they're all connected and work together, when one is compromised, everything else is affected. So it's super important to reduce tightness in all of those areas. So we're going to teach you a couple stretches today.
Yes.
Ray is first. He's going to demonstrate the lunging hip flexor stretch.
Tough.
If your hips become tight, your body will rely on and overwork your quads, which puts more pressure on the knees, so this is super important. So you're going to kneel on one knee, place the opposite knee on the ground, good job. Front thigh parallel about 90 degrees to the floor, and your hands are above your knee, perfect. And you're just going to lean forward, stretching your hip toward the floor. You feel that in your hip?
Yeah, I feel it.
You can also tighten your butt muscles to engage that a little bit more. Alright, if you're able to go a little bit deeper, you can do a lizard pose, and I'm just going to show you guys what that looks like. Alright, so basically you're in that lunge. You're going to scoot your foot over to the right, and you can bring your hands down to the floor. That gets a little deeper into the adductors. Or you can go even deeper and bring your elbows down to the floor and get that nice deep stretch in your hip flexors. So tight glutes can also cause the quads to take too much impact, consequently putting more pressure on the knees. It can also cause back pain and pain down the leg. So avoiding tightness in the glutes will actually help them engage better when you're exercising or doing anything in life. So Albert is going to demonstrate the figure 4 stretch. You're going to lay down on your back. You're going to bend your knees. You're going to cross your left foot over your right quad. Perfect. You're going to flex that foot, your right foot, to protect the knee. And then you're going to hold the back of your right leg and lift that foot off of the floor. And you're just going to pull that knee back towards your chest. Perfect. You feel that in your hips?
Oh, yeah.
So this helps with relieving low back pain and sciatica as well.
It feels good. Feels really good.
The hamstrings help support the hips and knees. It's common that a knee injury is caused by a hamstring strain, so it's important that the hamstrings stay loose and mobile. Gabe is going to demonstrate the standing hamstring stretch. Stand on your right foot with your left foot in front of you. Perfect. You toes up off the floor. There you go. Bend into your left knee and lean back. All right, another option for stretching the hamstrings, go ahead and stand up, is a standing forward fold. Put your hands on your hips. You're gonna pull in your belly, and then you're just gonna slowly start to lean forward with your back straight. You feel that in your hamstrings?
Yeah.
If you're more flexible, more flexy, you can bring your fingers down to the floor.
That's my limit.
If you have clients that aren't even able to come even halfway down, they could put their hands on a chair or the wall and just hold it, and it'll hit the back of their hamstrings and the backs of their legs. So Albert's gonna show us a nice calf stretch. Now place your hands on the wall and straight leg behind you, and you're gonna bend into that front knee. Okay. You just wanna make sure your heels stay planted onto the floor, and that's it. Adductors are the muscles inside your thighs that help stabilize your hips. Tight adductors can cause instability in your hips and pelvis and ultimately your knees. Today is going to show you how to open up your adductors. Alright, now you're going to bring the soles of your feet together. Okay, so you want to make sure you're still sitting upright with your head above your spine. Alright, so you're going to pull in your belly. You want to pull in your heels just as close as you can to you. You don't have to worry about coming too close, just as long as you're comfortable. Start bending forward, keeping your back straight. So you just want to come as far forward as you can to where you feel your adductors engage. If you want to go a little bit deeper, you can use your elbows to push your knees down. Perfect. How's that feel?
Feels great.
Awesome. And that is the adductor stretch of the day.
Oh, hey, how you doing?
Well, in our segment, what we're doing is some alternative knee exercises. So follow me. Let's go. If you see, we're in the big room now. I'm gonna have 3 exercises. The first one we're gonna have is bent leg extensions. Thank you, Gabriel. As you can tell, he loves me because I taught him this move. We'll sit down on the bench. There you go. Sit down. Down we go. So what you want to do is have his or her feet flat. You're gonna start extending the leg, straightening it out, but not straightening it out all the way. As you can see, there's a bend here in his knee, which is taking away some of the extension of the knee, so it's just perfectly bent. And what you're gonna do is lower it very slowly. There you go. And we're gonna repeat this from 15 to 20 times, depending on the client. And that's it for the bent leg extension. So another exercise we're gonna do is hip raises. As you know, your hips are related to your knees. When I say they're related, they correlate together, as in, if there's some weak positioning in your hips somewhere, whether it's your hip flexors or inside of your hips, you want to strengthen those in order to make sure we don't cause any more damage to the knees and surrounding areas. So what we're gonna do here, we're gonna have Gabriel. Gabriel is gonna put his legs up, so not legs up, but he's gonna bring his legs back almost to a crunch position. Thank you, Gabriel, for being such a cooperative member. And what you're gonna do here is you're gonna raise your hips all the way. There you go. And what you wanna do is suck in your belly button, making sure it's tight. And then also you're gonna lower the hips now, slowly. And we're gonna do this one more time. We're gonna repeat this again from 15 to 20 times, depending on the client. And that should help with strengthening the hips. And also, once you strengthen the hips, you should be able to also strengthen the knees. There you go. So our last exercise is the wall squat with the ball. You can start them off here, and this will strengthen the knee and primarily target the glutes. They can gloat.
Yes.
So what we're gonna do here, we're gonna have our wonderful assistant Gabriel. He's gonna start to lower it down very slowly. Okay, so depending on how bad the injury is to the knee, we're gonna just lower have the client lower as much as they can. Let's say from right here, and then slowly start to come back to the top position. And when they get back to the top position, we don't want them to fully extend their leg or fully straighten out their leg, in order to make sure that there's still a bit of weight on the while the exercise is going on. Good job. Slowly breathing, keeping that core engaged, chest high. Slowly bringing it back up to the top position. As you can see, this is one of a really good starter exercise for someone who has bad knees and just wants to strengthen their quads, their glutes, and also keeping their core tight before they do the leg press. Thank you.
I'm Steph.
I'm Albs.
And Ray.
Gabriel,
Gabriel.
thank you for watching with us at the West LA studio.
Hope you learned something today.
Especially about the knee.
Yeah.
Have a good one, guys.
There you go, look. Oh!